Hello everyone, and welcome back to my channel. Today I have a very important topic to discuss with you, the respiratory syncytial virus, RSV. Have you ever heard of RSV? It's a common virus that causes colds and flu, but it can also be very serious for young children. It can affect their lungs and make them have trouble breathing. It can even lead to hospitalization or complications if not treated properly. This is what almost happened to me and my 10-month-old daughter a month ago. She got RSV and it was a very scary experience. I want to share our story with you and give you some tips on how to prevent and treat RSV. It all started with a runny nose. My daughter had a mild cold and I didn't think much of it. But then she started to have a fever and a cough. She was coughing so much that she had thick mucus in her throat, and he didn't want to eat anything. She was very unhappy and uncomfortable. I was worried sick. I called our pediatrician, and they told me to watch for some signs that could mean she had a serious lung infection. They said to look for rapid or labored breathing, feeding difficulties, pale or bluish skin when coughing. They also told me to do some things to help her feel better, such as giving her plenty of breast milk. Breast milk can provide hydration, nutrition, and antibodies to your baby, and it can also help soothe their throat and reduce inflammation. However, I had to feed her at shorter intervals while her nose was stuffed, and to make sure she got enough fluids, I also gave her some water. Elevating her head slightly while lying down. This can help your baby breathe easier and prevent the mucus from blocking their airways. I used some books to raise the head end of her bed, and I made sure she was comfortable and safe. Dropping salt water drops in her nose to thin the mucus. This can help your baby clear their nose and reduce congestion. I did this especially before breastfeeding and sleeping, to make sure she could feed and rest well. They said that most babies recover from RSV on their own within a week or two, but some may need extra care or hospitalization. We followed their advice and kept a close eye on her. It was a tough few days, but she gradually improved. Her fever went down, her cough became less, and her breathing became easier. She started to eat and drink again, and she became more cheerful and playful. She didn't need to go to the hospital, but we were ready to take her if she got worse. We were so relieved when she got better. RSV is a very common virus, and it can affect anyone, but it's especially dangerous for babies under 1 year old. Their immune systems are still developing, and they can't fight off the virus as well as older children or adults. So, how can you protect your baby from RSV? Here are some things you can do. Keep your baby and yourself clean and healthy. Wash your hands often, cover your mouth and nose when you cough or sneeze, and avoid sharing personal items. Keep your baby away from people who are sick, and avoid crowded places during the winter, when RSV is more common. If your baby gets RSV, watch for the signs of a serious lung infection and seek medical attention if needed. Follow the tips to help your baby feel better, and let them rest and sleep as much as possible. RSV can be scary, but it can also be prevented and treated. I hope this video has been helpful and informative for you. If you liked it, please give it a thumbs up and subscribe to my channel for more insightful parenting tips. And if you have any questions or comments, feel free to leave them below. Thank you for watching, and I'll see you in the next video.